Fearing the polling momentum of the BC Conservative Party, British Columbia Premier David Eby and his BC NDP party are now going on the offensive against John Rustad and the BC Conservatives on the issue of healthcare. Probably the dumbest thing the BC NDP could do because their record on healthcare is absolutely abysmal. But before I get into digging into the record of David Eby and the NDP on healthcare, I just want to show you what the NDP posted on X the other day. This post that they made a few days ago said, John Rustad and the BC Liberals promised to get every British Columbian a family doctor by 2015. Then they said no to a second medical school and made the problem much worse. David Eby is building it and training more family doctors. And then the graphic says, building a new medical school in Surrey to train more doctors. Over David Eby's photo, and then over John Rustad, it said no to a new medical school in 2009 and let the doctor shortage get worse. This is extremely hilarious and ironic at the same time. You might be thinking to yourself, if you live in BC and you know about the situation, didn't David Eby fire all unvaccinated nurses and doctors who didn't want to get the COVID vaccine, and they still haven't been allowed back to work? And we are in the middle of a doctor shortage, as he is admitting. He's trying to fight back by building a new school, but why would you stop thousands of nurses and doctors from practicing in British Columbia? Well, it's because David Eby is an activist. He is not an actual government manager. He doesn't know how to manage anything. He's not a leader. He is a protester who somehow is occupying the premier's office. And it's absolutely insane why they would even bring up healthcare. Their performance is absolutely terrible. Let's start off with what David Eby is trying to invoke in this post about the idea that John Rustad is somehow against expanding the amount of doctors and nurses in the province, and David Eby is fighting hard to do so. How is it that between 2015 and 16, when the NDP first came into office, and now, by the end of 2020, and it's gotten even worse since then, we just don't have statistics for it, the amount of doctors, the percentage of British Columbians who have a family doctor has fallen from 83.4% all the way down to 81.7%. I believe I saw recently the number might be as low as 78% or lower. Here's another thing, hip fracture surgeries that can be done within 48 hours. Back in 2018-19, when John Horgan was still in charge of the province, a much better NDP premier than David Eby, not good, but at least not horrific, the amount of people who were able to get surgery for a hip fracture, which is a standard metric for determining how well the healthcare system is performing, 86.3% of those procedures could be done in 48 hours back in the 2018-19 year. Now, in the 2022-23 year, only 72.3% of them are being done within that time. The Canadian performance overall has gone down, but it has not gone down at the rate it's gone down in British Columbia. And this is not because of international issues, not because a new medical school wasn't built. It's because of the policies of David Eby and the NDP. If they were actually offering proper incentives to become a doctor and they weren't literally firing doctors, they could get these procedures done faster and more British Columbians would have a family doctor. But David Eby just wants to pretend that rhetoric alone is the actual measure of leadership. So that John Rustad said something he didn't like back in 2009, that's the real problem, not the actual fact that the medical system in British Columbia is absolutely screwed right now. And although the NDP gets to coast along on the idea that they're the ones who really care about public services and they care about and public health, service spending per capita has been going down in British Columbia in the last few years. Yes, it was spiking during COVID, but it's actually flatlining while the population of the province is going up significantly. Yes, that is a problem of Justin Trudeau and the federal Liberals having a policy of mass immigration, but that's also a policy that David Eby endorses, he likes, and he is not allowed for the development of housing that can actually handle that population. And at the same time that the per capita service spending, program spending, has been going down in British Columbia, net debt has been going up significantly. Back in 2016-17, net debt per British Columbian was $10,000, around that. Now it's $13,500. That's a massive increase. Nobody could deny that. And although he can say, well, it's COVID spending, COVID era spending, you can't say that, well, I was irresponsible, but only during a couple year period, because this has been going on well before COVID. At least you could say that John Horgan was actually getting control of per capita debt. But since 2020, it actually didn't even exactly go up a lot during the actual COVID years. It's only going up now in 2023 and 24 because David Eby needs to win a re-election, and so he's throwing out money all over the place. So now I want to talk a little bit about healthcare wait times. Wait times tend to be the gold standard of how we evaluate the health of like a healthcare system. I got a lot of these from the Fraser Institute. I want to go to the 2019 numbers first, but this is the Canadian healthcare wait times back in between 1993 and 2019, which the Fraser Institute uses as their base because that was the first year they started tracking wait times across Canada and in specific provinces. So in Canada, back in 1993, wait times for seeing a general practitioner was 3.7 weeks. And from the specialist to actual treatment, it was 5.6 weeks for a total of 9.3 weeks on average to go from your GP to getting treatment from a specialist. In 2019, Canada's healthcare system had been deteriorating quite a bit, and it had gone from 9.3 weeks on average from GP to specialist treatment to 20.9 weeks. This is British Columbia during the same period. So in 1993, it was 10.4 weeks for the GP to specialist treatment, and by 2019, it was 24 weeks to specialist treatment. Yes, that's not David Eby's fault. He wasn't the premier during this time. Well, let's jump forward to a chart that actually shows a time period where he was premier for a significant amount of time or was in John Horgan's government. So this shows that since this number of 24 weeks in 2019, the BC healthcare wait times have jumped another 3.7 weeks. It is now 27.7 weeks on average in British Columbia from going from your general practitioner to actually getting specialist treatment. That is abysmal. And while it's not the worst in Canada, the other provinces have actually been improving. The worst in Canada outside of the Maritimes, where there are population issues regarding healthcare spending that's available because of it being a smaller revenue government jurisdiction. Alberta is the worst in Canada. I live in Alberta. It is the national shame or the provincial shame of Alberta that our healthcare system is actually quite bad despite all of the spending we do. Although we've actually been improving recently because they've been cutting the fat and decentralizing a lot of the healthcare decision making. They've actually been on, this is, I believe, wait times just for surgeries. Hip surgeries are a good long-term metric for how good your healthcare system is doing for wait times. When you actually go on the average wait time for hip surgeries has gone from 41 weeks to 38.7 to 35.9 to 35.4 to 30 weeks. That is an amazing increase. So I do not doubt that when the Fraser Institute surveys Alberta between the 2024 and 2025 years, our wait times are actually going to plunge significantly because Adrienne Lagrange, our health minister in Alberta, is actually cutting away the bureaucracy. She's actually letting doctors do their jobs and doing less nonsense paperwork. They're letting unvaccinated nurses and doctors come back and work for AHS or for their regional healthcare system, since they're going to be breaking up AHS because it's a massive bureaucratic money-burning pit. And so they're trying to make it sure that we're actually fast-tracking people to healthcare, not having all these bureaucratic checks and processes and paperwork barriers that stand in people's way from getting basic procedures done that have been done thousands of times, that got done literally tens of thousands of times a year. So there's no excuse for British Columbia, who is in a better position than Alberta, for their wait times to continue going up. BC should be able to make the improvements that Alberta has made, but David Eby is such an activist that he cares more about the ideal, the left-wing ideal, the public healthcare ideal of vaccine mandates. He cares more about servicing the bureaucracy, making sure that those bureaucratic union jobs are kept in place, that we have all of these nonsensical HR positions like held down. It's not about medical schools because we could be bringing in doctors from other provinces. If BC was such an attractive place to be a doctor, people would be jumping over the border to do it. People would be coming from overseas to be a doctor in BC, up from the United States, from Australia, New Zealand, the UK. But nobody wants to be a doctor in BC these days because either you have to be vaccinated or you have to deal with the bureaucratic tanglework of nonsense that David Eby and John Horgan before him have incentivized, because that helps the interest groups that get David Eby votes. Overpaid public service workers who don't actually have anything to do with healthcare. This was the biggest issue in Alberta for the longest time. For every nurse, there was an HR rep, there was some manager on their floor, there was multiple people who were just pushing paperwork around for getting approvals and doing diversity checks and doing other sort of like efficiency checks, all stuff that was actually making the system less efficient. And David Eby is doing the same thing that Alberta was doing wrong for so many years, getting more people hired into the healthcare system who have nothing to do with actual healthcare delivery. That's why I hope if you're in British Columbia, you consider voting for the BC Conservative Party, because they are actually going to make the BC healthcare system less bureaucratic and more healthcare focused, getting people care, not getting them paperwork effectively. Less paperwork, more actual medicine being practiced. So if you also live in British Columbia, consider donating to the BC Conservatives. The NDP still have a fundraising advantage over them, and even though the BC NDP are a flaming car wreck, the BC Conservatives are, even though they have less funding, can easily beat them. They are within 2 points of the NDP with a lot of time to go until the provincial election in October. They have a lot of momentum. They just need the money to actually be able to run campaigns. So I have a donation link in the description of this video below. Go and click on the BC donate button if you live in British Columbia. If you give $100, you get $75 back in a tax credit. But, so I'm begging you, make sure you actually fund the people that you're wanting to vote for, because if you don't donate, nobody else is going to donate, and you shouldn't expect them to. Anyways, that's it for me today, guys. If you don't live in British Columbia, then consider donating to my legal fund. We have a billionaire Chinese developer suing us for defamation for saying what? We don't know. He's just simply suing us for the sake of it because we mentioned an article where he was investigated. We didn't even report anything new about him, but and now in 2.5 years of this case going on, he still hasn't submitted any real evidence proving that we defamed him. He is merely saying it and throwing paperwork at us to try and make this lawsuit go on as long as possible. It's cost us over $30,000 at this point, so anything you can contribute really helps reduce the burden of cost on us. And you can also sign up on my website in the description below, WyattClaypool.com, if you want local recommendations for nomination races in your areas, provincial elections, federal elections, municipal elections. Basically, it allows me, if I know there's anything interesting going on in your area, to email you and other people on the list in that area to let you know about some interesting initiatives, movements, or candidates that you can check out. Anyways, that's it for me today, guys. Have a good one.